And first off tonight, the extent of our nursing home crisis is being fully revealed.
Exactly. For the first time, the state is now releasing the names of nursing homes experiencing outbreaks and how many cases they've had. It is an eye-opening and heartbreaking number. This is the view in Mecklenburg County. We knew of 8 outbreaks. Now it's up to 10, including for Cynthia Group Home, where sadly 17 people have died all across these facilities. Want to bring in now our government reporter Joe Bruno to begin our team coverage tonight. Joe, you've been pushing for this information for weeks now so that residents and their family members can really know what's going on.
Erica, that was the biggest problem with all of this, is that there were outbreaks in these facilities and people with loved ones in them had no idea. Finally, all of that is changing. Here's a look at where the outbreaks are at long-term care facilities in Mecklenburg County. 10 facilities in total. They combine for 157 cases and 17 deaths. That's about 11% of the cases we've seen in Meck County and about 40% of deaths. The state says Autumn Care in Cornelius has seen 53 cases and 10 deaths. That's the most in the county. In Ballantyne, the Pavilion Health Center has had 26 cases and 3 deaths. And in Cotswold, the Social has seen 26 cases and 3 deaths.
As this pandemic evolves, we will continue to assess the appropriateness of data reporting to balance transparency, public health, and individual privacy.
Mecklenburg County wasn't providing any of this information until we called them out on it 2 weeks ago. Then the county started identifying the facilities, but they wouldn't say how many cases were at each place. All of that has since changed. The state is releasing this information now, and coming up on Eyewitness News at 6, we'll take a look at some of the reasons why the state is now doing this. Erica?
Well, thanks for pushing and being persistent about getting those answers, Joe, especially for people who haven't been able to visit their loved ones in those nursing homes.
Now, the county's positive patients inside of nursing homes are now being cared for all in one facility. But to make room, the current residents at Huntersville Oaks are going to have to move out. And today is that day for that to happen. Channel 9's Mark Becker is continuing our team coverage tonight with one family that believes this move is also risky.
ATRIUM announced that they were going to be moving residents out of Huntersville Oaks starting today to make room for COVID-positive patients that would all be treated here. The problem is family members of residents here tell us they didn't find out about that plan until just 2 days ago.
I got the call Saturday morning.
It was on that call Benita Graham learned that after 5 years at Huntersville Oaks, her 84-year-old mother would have to move out to make way for patients who are COVID positive.
I said, to me, that doesn't seem fair to uproot them from that's their residence.
But what really worries Benita Graham and her daughter Bianca is that her mother had a stroke just 3 weeks ago and may not be strong enough to handle a move.
3 weeks ago, she was near death, and now for her to move, it just doesn't seem like it's the best. It doesn't seem like it presents the best situation for her health.
We spoke with 2 other families with loved ones here who share those same concerns. ATRIUM says they're making the move because Huntersville Oaks is one of the few skilled nursing facilities capable of handling COVID-positive patients. They say in the end it'll save lives. And the move does have the blessing of North Carolina's Healthcare Facilities Association.
Really trying to find that dedicated unit is consistent with recommendations from health agencies, and it focuses the care resources for these patients along with the care needs and the safety of other patients and residents.
But that can't ease the fears for families of fragile loved ones who are now facing a big unwanted change.
I really do not know how she's going to take it.
ATRIUM has told families it'll take 7 to 10 days to move everyone out here. What they haven't said, though, is whether or not they may ever return. Back to you.
All right, some more questions that we'll work to get answers to. Meantime, Rowan County now has its 3rd outbreak at a nursing home. This new outbreak at Liberty Commons in Salisbury. Rowan County officials telling us they have 124 cases linked to nursing homes. 109 of those are at the Citadel in Salisbury, and 15 people have died at the Citadel. 4 others died at the North Carolina State Veterans Home in Salisbury. Union County now reporting its third nursing home with an outbreak. Officials saying that outbreak happened at Autumn Care of Marshville on West Pfeiffer Street. Now, 2 weeks ago, the county reported outbreaks at Monroe Rehabilitation Center and Woodridge Nursing Facility.
As we continue to track the number of positive cases, North Carolina now says it will expand what's called contact tracing. That's where they track the cases to figure out where the outbreaks are happening and where more cases seem to be popping up. And the state is hiring and training 500 people throughout the state to do that. Tonight, there are 473 people in the hospital across the state. 9,142 tests have come back positive out of about 110,000 tests that were done. There have been 306 deaths. Most people who get it are recovering. Now, Governor Henry McMaster has extended South Carolina's state of emergency, which was set to expire today. Across the state, more than 52,000 people have been tested, and out of that number, 5,600 people have tested positive, and in South Carolina, 177 people have died.
So how does this sound? Attending school in rotating shifts, social distancing on school buses. The next academic year will likely look a whole lot different than we've been used to. Channel 9 education reporter Elsa Gillis sat down one-on-one with the state's top educator who's figuring out how all of this would work. It's a story every parent is going to want to hear.
We need to socially distance for a long time before we have a vaccine. And that means socially distancing on a school bus, socially distancing in a classroom. So we are looking at perhaps some students come for 2 days and then do remote learning at home for 2 days. Other students come for 2 days. Perhaps just the people who need to come in.
So remote learning is a possibility in the fall in some form or another.
Absolutely. Everyone should know that we are working to improve it. But if heaven forbid we have another spike, which many of the health experts are saying is a possibility, and we have to go back to remote learning, that's something we should be prepared for. No one's happy about this. I mean, this is very upsetting, but it is our goal to be proactive and try to get to a better sense of normal than where we are now.
One of the biggest things I think it's fair to say that we've discovered in this time is that we have some serious equity issues.
Yes.
They are highlighted more than ever. Do you have a figure of how many families we've not been able to reach yet?
Yes, we are concerned that it ranges from tens of thousands of students to over 100,000 students who really fall into that category of no internet connection. And that's why it's also important to get students back in the school building. So it might not be every student every day, but clearly that student would better benefit from being in the physical building.
Well, as a parent, I certainly have a lot of questions. I'm sure the other parents out there do as well. But Elsa, there's clearly, as we're hearing, a lot more that still needs to be worked out.
Oh, absolutely, Erica. And while leaders have said that the new school year will not be business as usual, I want to be very clear. Johnson said today they are in the early stages of figuring this out. And he shared one option with me today, how it would work, what students would go to school when, and how that would coordinate with sibling schedules, parent work schedules. That all would need to be figured out. Thankfully, we have the summer months to do so, and he says they're establishing a task force, and their job will be to figure out the new school year, how that would work, and also address remote learning obstacles and that equity gap. Erica?
Yeah, well, believe it or not, a lot of kids are anxious to get back to school and to see their friends and teachers. Thank you, Elsa. Top of mind are the seniors. They're missing out on their final weeks of high school. CMS has created a graduation task force to make sure that our local seniors are honored, and they want your ideas on how to do it. We've got a link to the survey online on our WSOC TV app.
One of the people who was behind the Reopen NC effort is claiming that she tested positive for COVID-19. Audrey Whitlock is an administrator for their page and says she ended her 14-day quarantine yesterday. She said she was asymptomatic, so had no symptoms of the virus that others have. It's not clear if she was at last week's protest in Raleigh. This is video of that rally as people demanded the governor reopen businesses around the state. And we're getting a better idea of how much help North Carolina is now going to be getting from the federal government. A White House official telling Channel 9 today the state has received more than $1.1 billion from the Department of Health and Human Services, and more than 39,000 small businesses in the state have received loans, so they can keep going for now. Now, FEMA has also sent more than 243,000 of those N95 masks and an additional 580,000 surgical masks to our doctors and nurses. The agency also sent more than 114,000 face shields, almost 426,000 gloves, and 109,000 medical gowns too. Well, this afternoon, state leaders talked about the goal of having a 30-day supply of PPE on hand before they reopen the state. They say right now they have enough gloves and surgical masks, but the state has less than a week's supply of the N95 masks and gowns.
Novant Health is taking new steps to protect newborn babies and their mothers. Anchor Allison Lottis learned that starting today, doctors are testing pregnant patients before they deliver.
Personally, being an expecting mom, I want to know, what should we anticipate when we come to the hospital to deliver?
When you come in to deliver, you'll be given the opportunity to be tested, so that way you'll know if you are positive or negative.
Is Novant mandating that a positive mom pump and have someone else feed the baby, or will she still be provided that skin-to-skin time and the ability to nurse?
Right now, we are not mandating that. We're just saying, giving it more of a discussion of say, hey, this is what the data that we have, and as data is kind of slowly evolving, this is the information that we're getting. This is what the CDC recommends, but we value that skin-to-skin. We value, that, breastfeeding initiative. So what are ways, if you do decline separation, then how can we make that still safe for you and safe for the newborn? And so that's when it would just be, making sure that mom is wearing a mask.
Does she still have a support person with her through labor and delivery?
Yes, so she would be still allowed a support person through labor and delivery. We would just be specific guidelines for as what masking we would do for that person. I think it's really important to know, though, that the safest place to deliver, even amidst all of this, is in the hospital.
Yeah, protecting those little ones most vulnerable. Today, Atrium Health started performing non-essential surgeries again. The hospital suspended them nearly 5 weeks ago as the number of coronavirus cases started to spike. Well, now that these surgeries can continue, Atrium will step up its safety precautions for all patients, and that includes testing for COVID-19 before procedures and offering virtual care so some patients can stay at home. Novant Health is following suit.